Hi everyone, so if you've seen my previous video about the safety around injecting around these areas, including the eyes and forehead, then this might interest you as well. When it comes to lips, people think that it is a much safer area to inject. It is, but when it comes to faces, there isn't such a thing as a completely safe area to inject. This is why it's important to always make sure that you're being injected by somebody who's qualified to do these injections and who is well trained and experienced, and also to make sure that you're dealing with someone who is trained in dealing with side effects. So side effects and complications can happen. There are ways that we can minimize those risks, and some of which I'll talk about today, but when they do happen, you need to be in the hands of a doctor who can treat those side effects, including things like anaphylactic shock. So these things do happen when it comes to injectables and medications, so it's important to make sure that you're not trying to skimp and go to somewhere where it's not really legal to get those types of treatments and injections, because you could pay very dearly. So when it comes to the lips, what we have to be aware of is that the injectables that we use around and inside the lips can create inflammation. So that type of swelling can obstruct blood vessels from the outside of those vessels, even if we're careful and we make sure that we don't inject into the vessels. So what we have to do is to, go slowly. Although patients do sometimes want to give or have a very fast result and something very impressive very quickly, we discourage that. We want patients to go slowly. We want to allow the product to work its way into the skin, to settle, to integrate, and that way we're able to give them a much more natural looking result without looking fake, without looking overblown, and also without creating a situation where you could potentially create necrosis in the tissue. I have seen patients who have had injectables done where that has actually happened. We have treated that. We have treated scarring as a result of those types of injections and those types of problems. There is a trend on social media for people to put up very dramatic looking pictures, and obviously there's a bit of treatment that goes on, things like lip gloss, but it's made to give somebody the illusion of a very successful result. But of course, when you overfill a lip and it does settle through inflammation and bleeding, you do tend to get a result that might be quite uneven, especially where we see injectables being mixed with other products. The most important thing to do is to make sure that you are looking out for yourself, making sure that you're going to a practice with a good reputation. As you can see, the vessels do run around the lips, and there are certain ways that we can inject using small volumes and in certain areas to minimize the risk of injury to the vessels. Of course, lips are pink because they are very vascular. The risks of bruising when it comes to injections into the lips are not negligible. I think most people who have injections in the lips will have some bruising, so it's important to take that downtime into account when you're having your lip injections.